This is Biernacki, and today I'm going to be talking about lymphedema or swollen ankles. What this means is that you have thick, red, irritated, discolored skin. It's always swollen. So when you come home at the end of the day, your legs are swollen, they're achy. This could be lymphedema. I'm going to talk about how to take care of lymphedema, the treatments, what to do about it. Is there a cure? The causes, the symptoms, pretty much everything, and kind of the tricks of the trade. And we're starting right now. Guys, thank you so much for watching this video. We appreciate your likes, your subscribes, your comment. We really love hearing if this stuff helps. It really makes a big difference for us, so thank you. So the trick is, lymphedema differs from venous stasis edema. So venous stasis is more of like a non-pitting swelling. That's kind of the general swelling that happens at the end of the day after a long work day. Your legs are swollen, they're achy, your feet, your ankles. A lot of these treatments will help that we're going to talk about, but the reality is lymphedema is worse. Lymphedema is your lymph vessels are actually destroyed, and not only does your skin swell, but protein accumulates in the gravity affected areas like your ankles, your feet, and your skin can start to turn hard and scaly. If you ever saw like the condition elephantiasis, this can be similar and related. So when I see people like the red, indurated, thick, scaly skin that can get cracks or always needs to be moisturized, never seems to get better, almost starts to develop like a tree bark-like effect with discoloration, with redness, this could be lymphedema. This is particularly important because it's terrible for your health. It increases your risk of cellulitis, infection, poor quality skin, and this can get worse and worse and accumulate, stop you from exercising, stop you from moving. So it's really important to take care of this. What I usually see is not only do you have lymphedema, there's like the pure edema that's caused by like radiation, like cancer, like infections or parasitic infection. Most people don't have this except for like cancer survivors, but it's usually a combination of lymphedema and venous stasis that I see. Even though, you know, it could be both, it's kind of tricky to tell. But what lymphedema is when you start to get that thick, scaly, indurated quality, that redness, that brownish discoloration. Now, the solutions I'm going to talk about aren't just lymphedema only, because unfortunately, that's not a real curable disease, and that is very depressing. So I know in the comments people say, hey, my doctor said this thing's not curable. But there's a lot of therapies and treatments that you can do that I find with my own patients have a lot of effect. So we're going to talk about all this stuff that's very effective, and there is some hope. But the bottom line is, go see your podiatrist, go see your internal medicine doctor, because you need to be evaluated properly. That means a history and physical, x-rays, MRIs, scans, lab work. Because the reality is there's a lot of underlying diseases like kidney problems, lungs, heart, congestive heart failure. And these things are essential to get treated before. So this is something that I'll talk about towards the end of the video, but lifestyle changes are huge. So weight loss, eating your vegetables, keeping healthy, and exercising as much as possible. These are very, very important things to your overall health. This will help all types of swelling, heart problems, kidney problems, lung problems. All of this gives you a better chance. But then you actually have to treat the underlying disease. So if you have a heart problem, you have to treat that heart problem with a cardiologist and your internal medicine doctor. Or if you have a kidney problem, a nephrologist, and you have to work on it. If you have other systemic problems like diabetes, you have to treat that with an endocrinologist. I'm going to come at it from a podiatry standpoint, because as a foot doctor, there's a ton of things that you can do without having to take medications and without having to do surgery. But there are medications. I'm going to let the internal medicine doctors take care of that. But blood pressure medications, can help, but they're a symptomatic treatment. What I do from my standpoint is surgery for lymphedema. Now, I haven't really seen practical results like replacing lymph nodes or trying to repair the lymph vessels, because once that damage is done, it's almost like scar tissue that can be permanent to a degree. But what I do is that thick, dry, scaly skin, there's a lot of stuff that we can do. In clinic, I do this all the time, where we put met lotions medications, zinc oxide wraps to kind of exfoliate that thickened, dry, crusty skin. Within a couple weeks of seeing a podiatrist, generally we can get rid of a lot of that thick, dry, scaly skin. But this requires almost weekly wraps. You can combine this with home care. You can combine this with getting taken care of, with your doctor, with weekly visits. As it starts to get better, then you can put longer term strategies into effect. But the surgery is really using a scalpel, burrs, Dremels to kind of clean off all that dry skin to help exfoliate it. That's a combination of moisturizing. Another way to get rid of that thick, dry, scaly skin initially is Epsom salt soaks. I love foot baths with Epsom salt. You can put your feet into a big bin with Epsom salt, 15-20 minutes of lukewarm water. A lot of that dry, scaly crust will come down. A lot of that swelling will kind of help flow through your body. That can really help. Another way to get rid of that thick, dry, scaly skin is Una wraps. So we do that in our office. So basically a wrap that goes up your toes, up your ankles, and up your legs, and it's coated with zinc oxide. Over a couple days, that zinc oxide kind of squishes into that dry, scaly skin, softens it up, and it comes off without cutting or ripping the skin. And the skin quickly, over a couple of weeks, looks a whole lot better, and the swelling is down. That really works well for me. So a combination of, edema control with, those salt water or Epsom salt soaks. You could also do Una wraps, and that symptomatically gets that thick, dry skin off there. What I like to do at this point is, for true lymphedema, we can write a prescription for sequential compression wraps. These can be really expensive if insurance doesn't cover them, but while you're sitting watching TV, these can squeeze your legs for an hour or two, and that really pushes the fluid back out, and you urinate it out, you get it out through a lot of different ways. But I've seen patients get 5, 10, 15 plus pounds off their legs pretty quickly doing these things. But you want to make sure it's monitored with the doctor and do it safely. Now, if you have a lighter case where it's a venous stasis and lymphedema, while you're sitting at the computer or not moving, I like to buy ones even online. They're like $100 or less, like $50. Those sequential cuffs that compress. I personally use them, for my own swelling in my legs, even though I don't have lymphedema, I have more venous stasis. If you're sitting and working all day, it makes a huge difference. You have less of a headache, you have less of an energy drop, and you have more blood circulating through your legs. And I do this to a lot of my friends, a lot of my patients. Almost everybody, if they use these, they say they feel less tired, they feel more energetic, and they have less swelling during the day. So you can see I actually purchased this thing a little while ago, but this is a pretty good one. See, it's even got a coupon. With inflation, I used to buy this thing for like $40, $50, but I guess everything's going up with inflation. So it's a little bit more, although it says it's a discount. You have a $5 off coupon, but I personally got this brand. It goes around your calf muscles. Just be careful. It's a little bit strong when you first start it. So it's got 3 settings, I believe. So 3 little dots there. I always tell people to start on the lowest setting. So you can put it on your arms, but where I really recommend it is kind of down on the feet right there. Probably on the calf muscles is the best. The other 3 are probably not that important. And really you just wrap it around, the hose comes out the back, and it inflates. It's as simple as that. That works really well. There's a couple buttons you push. So I've given this to lots of coworkers. I've used it myself. This thing is phenomenal and has good results. Compression dressings, I personally in the office for cuts, bruises, use an edema wrap to compress that and get that dry skin down. But what works well is compression stockings as well. Now, insurance kind of covers these, but they have to be very high strength. And I notice patients don't really wear the higher strength ones. I recommend get some regular, like 10 millimeter of mercury compression socks online. They're pretty cheap, like the knee-high socks, especially if you're walking or standing or sitting all day. These can make a big difference. They're a little bit easier to get on. If you feel that those are helping, then maybe ask your podiatrist for a higher compression strength stocking. But always check with your doctor before you try something like this. So check out some of these compression socks right here. So you could see down here the different size. They actually do a good job showing you the different colors here, but specifically what you want to look at is they're not that expensive. Like 8 pairs for $17. Like, I mean, come on, that's like $2 per pair of socks. So it's like $1 per sock that you can keep re-wearing. So you can kind of see these are meant to be more athletic. There's some sizing guides, but these are marketed as nursing socks, but what I want you to look at is 15 to 20 millimeters of mercury. This is too low of compression for insurance to cover. Most adults that have swelling problems will not be able to get on the 20 to 30 or 40 millimeter compression socks. These are so tight that nobody wears them. In my experience, everybody tries to buy them, but maybe like 2% of people actually wear them. Get something that's low cost. So for like, a dollar per pair here, that's lower compression. If you find that it's not enough compression for you, then get something heavier. Don't goof around starting with like the 40 millimeter of mercury, trying to get insurance to cover it, because you're going to jump through a lot of hoops. You're going to waste a lot of time, and it's going to cut into your skin, and you're going to hate it. If you're like 98% of the patients I see, start with something low cost and lower compression, see how it works, see how it fits into your routine, and then go up to the higher compression. At the same time, take a look right here. The 20 to 30 millimeter of mercury are like $15. Why would you waste time driving to like different outlets, wasting gas, especially the price it is, trying to exchange prescriptions from your doctor to the medical supply company to get something like this when it's so cheap online? It just doesn't make a lot of sense to me. And realistically, you should go with the lower compression. This, for the average person, is probably a little bit too high and doesn't provide a ton of benefit. It'll cut into your skin and hurt you more than it will benefit you. So start with the lower compression rather than the high compression. Down in the show notes, I include my favorites. Physical therapy. Physical therapy can work really well. There's a lot of lymphedema clinics, and it's basically exercises and wraps that they do, but this requires regular visits. I also write a lot of prescriptions for home care for this type of thing, to take care of people and get them feeling better at home. So that's a strong option if you visit your podiatrist. Exercises can work really well. So exercise, stretch, get your muscle strength up. Make sure your heart's healthy enough with your doctor, but this can make a big difference in getting your blood flow circulation going. This is a big cause of ankle swelling that's correctable by exercise. Look at my left foot compared to my right foot. My left foot can't bend up as much as my right foot. See that? It's about a 10-degree difference, and I'll show that in a second. But see, now it has to turn out. By not being able to turn up as much and being stiff through my hamstring, through my calf muscle, it creates that difference. That means my leg will swell and get more sore through the muscles as I land on it, because that muscle and leg has to work harder. That can explain why one leg's more swollen than the other. So look at this healthy young man right here that's flexible. He's running and his feet are landing straight. They're not buckling out. This is normal running. Whereas a condition called overpronation, look at how much that ankle sags in when this person runs. As people get older and stiffer through their hamstrings, back, and calf muscles, the foot bends out, the muscles have to work harder, and as a result, they swell because the muscles are working harder. So take a look at this older gentleman. He doesn't really have flexibility through his feet, ankles, and hamstrings. His muscles have to work significantly harder. This is why older people can sometimes get more swelling and sore muscles. So you want to get stronger and more flexible. These are basic little things to get rid of the foot pain. So what happens is massaging with a cold water bottle or a cold can can really help, especially with your plantar fascia. There's devices out there like this is a ball that you can freeze. It's not as great for the foot, but you can use it on your calf. You can massage it. So you can massage the bottom of your feet. I like that because you could use gravity if you can't bend over, but just massaging can get some of that blood flowing out of your foot. That can really make a big difference. I personally like a massage roller stick. What this can do is use your calf muscle underneath your hamstring, the front of your leg. Don't use it on the bone, but the muscles for sure. That can get some of that fluid out of there. It could get that muscle swelling down. But it's important not to just massage, but you have to prevent the damage in the first place through good biomechanics. So what you do then is you have to focus on stretching. So I'm not talking a 1-hour yoga routine every day. I'm talking like 2, 3, 4 minutes of stretching. Work on your health. Start stretching, start getting flexible in the morning and in the evening after you're done a day of work. But hold your calf muscles, your hamstrings, get some pressure off there. That can make a big difference. And then keep moisturizing your skin there. So lotions, keep working well. And you can get stronger lotions. Like me as a podiatrist, I could write you a prescription for stronger things. And at the same time, you might want to see your internal medicine doctor. You might need some anti-swelling pills. They're called diuretics. There's a few other different things, but I'm not a big fan of going just medication routes. Get to the root of it. Fix your biomechanics, get your strength up, get your flexibility up. Take care of your skin. Once you get that initial crust off, moisturizing lotions, creams. I have some links to some favorites online that work really well, but don't let that skin get hard, because the hard skin will make your skin more inflamed and irritated, and that can cause even more swelling. It's a vicious cycle. So moisturize regularly once you get over that initial lymphedema hump. And take care of your whole body. Eat your vegetables, get your blood pressure down, get your strength up as much as possible. Wear good shoes, wear good orthotics. One thing that makes a big difference is a supportive slipper. So Spenco is my favorite, but slippers at home. If you're walking barefoot and you have a lot of foot and ankle swelling, get some supportive slippers like Spenco, Bionic. This makes a huge difference. Or if you wear a shoe at home, put some orthotics into it. As far as slippers goes, I'm a big fan of Bionic slippers for women. So see, for these types, you have pretty nice built-in arches. They're not really expensive. They're like in the $40, $30 range. But you can see the arch is pretty aggressive in most of these. You can't really go wrong with a brand like Bionic. So Bionic is excellent. Bionic caters more towards ladies, I would say. Even though they do have some shoes, I would recommend don't use them for shoes, but kind of like a house slipper to walk around the house. They are fantastic. There are better shoes you can get though. For men, I would recommend something like a Spenco. So see, they're just a little bit more earth tones. I kind of have this one up here in the corner. That works really well. So these can work really well. See, they make slippers, sandals. My wife uses these. She loves the siesta slide. So these are really good as well. So Spenco and Bionic are great. For shoes inside the house, if I had to pick just one, go with the Brooks Ghost that's down in the show notes. So you can see last year's model is a little bit cheaper at about $109. The new model, the 14, is like $140. These are phenomenal shoes. If you can get an insole from your podiatrist, an over-the-counter insole, and again, down in the show notes are my favorite, get a good Brooks Ghost. Get the insoles we recommend down in the show notes. It's going to really make a big difference for you. I personally, right now, am wearing a good supportive shoe. Brooks are one of my favorite. So I always wear a good supportive shoe inside the house with orthotics. What this does is a shoe and an orthotic can lower how hard your muscles have to work. And if your muscles are working less hard, then you're swelling less. This is probably the easiest thing you can do. Getting good slippers at home, getting good orthotics inside your shoes, or wearing shoes at home can do even better, but it's a little bit more annoying to put on a good supportive shoe and slipper. If you do anything at all, get a good supportive slipper. Some of the links are down below. Some of my favorites, Spenco, Bionic, are great brands. These really get your swelling down quickly. There's no real risk to doing this. There's risk to medications, but shoes, orthotics, not a real risk. If that's helping, then get some ankle compression sleeves that are easy and low cost to wear. We're talking like 20 bucks for something that's probably going to help and pretty easy to get on. So slippers, shoes, orthotics, ankle compression devices, those work extremely well. And then eat your vegetables, exercise, live a healthy lifestyle, stop smoking, stop the alcohol. All this type of stuff will make a huge difference in taking care of your lymphedema, your venous stasis edema, and keep you in great healthy shape. Another thing is go see your podiatrist, because if you're suffering at work, we can write you letters for sit down on your chair, less motion, less 12 hours standing all day long. This really does impact the body in a negative way. Get into good morning routine. So when I wake up in the morning, I rotate my ankles. I get that blood flowing. So everybody's stiff and tight in the morning. So just sit down, rotate your ankles. I like to grab a towel. So first, it's tough for most people to touch your toes. So you can grab a towel and get around your foot. So you could hold that up. That stretches out your hamstring, which is between your butt and your knee, and your calf muscle, which is between your knee and your ankle joint. Those are usually what's tight in most people. If you loosen that up, your feet don't have to work as hard in terms of flattening out and turning out. So another way to do it is put a towel underneath your toes and just lean forward. You know, if something's hurting, don't press as hard into your knees, kind of how I'm doing. That could hurt some people's backs, some people's hips if you're too tight. Start slow, start gentle. Nothing should ever hurt. And then the inside of your thighs. And these stretching boards are available. So this was like $50. I'm sure it's probably up a little bit with inflation, but start on the lower setting and then gradually as a week goes up, maybe work your way up to the next level. As another week goes up, you can work your way to another level and you can see your calf muscles, your hamstrings are gradually going to be loosening up. So this is a great way to measure your flexibility. This could lead to less swelling, less muscle pain due to being more flexible. And if that helped, check out our flat foot guide. Give us a like, give us a subscribe. We try to reply to all our comments, so we love hearing feedback from you. Thank you.